In this video, we will talk about hepatitis B virus infection in detail. Hepatitis B can cause acute or chronic infection. Hepatitis B is an important cause of hepatocellular carcinoma. Moreover, it is 50 to 100 times more infectious than HIV. Hepatitis B virus infection may progress gradually with no symptoms at all for 10 to 20 years. After a long period, chronic hepatitis B infection may present with cirrhosis. In addition, the chances of developing chronic hepatitis are higher in those who are infected with hepatitis B virus at younger age. About 90% of those infected during or shortly after birth develop chronic hepatitis B. The natural course of hepatitis B is different from person to person. The speed of inflammation and scarring may vary between patients. During hepatitis B virus infection, the host immune response tries to eliminate virus. However, this process can lead to hepatocellular damage. In 90% adults with hepatitis B, the immune system successfully fights during the acute phase. Consequently, the virus disappears from the body within 6 months. Liver heals completely and person becomes immune to hepatitis B infection for the rest of his life. However, in rest of 10% of cases, the immune system cannot clear the virus and infection persists beyond the 6 month, called as chronic hepatitis B infection. Symptoms of acute hepatitis B virus infection are jaundice, dark colored urine along with light colored stools, lethargy, abdominal pain, anorexia, nausea, and fever. Hepatitis B virus infection lasting longer than 6 months is considered chronic. Chronic hepatitis B virus infection can lead to liver cirrhosis. The following are the features of cirrhosis: ascites, jaundice, itching, easy bruising, encephalopathy. How do people get the hepatitis B virus infection? Hepatitis B virus infected women pass the infection to their babies during the birth process. Moreover, hepatitis B infection can be transmitted by sharing needles, sexual contact with an infected person, accidental needle stick injury with a contaminated needle, acupuncture, piercing, tattooing, hemodialysis, healthcare workers, men who have sex with men. Hepatitis B virus infection cannot be spread by holding hands, sharing eating utensils, hugging, coughing and sneezing, and breastfeeding. While talking about diagnosis, here you can see hepatitis B surface antigen. Hepatitis B surface antigen is used to screen for presence of hepatitis B infection. It is the first detectable viral antigen to appear during infection. Shortly after the appearance of hepatitis B surface antigen, another antigen called as hepatitis B E antigen appears. Presence of hepatitis B E antigen in a host serum is associated with much higher rates of viral replication and high infectivity. But variants of hepatitis B virus do not produce the E antigen, so this above rule is not always applicable. During the natural course of the disease, the HBe antigen may be cleared, and antibodies to the E antigen and THBe appear afterwards. If the host is able to clear the infection, then hepatitis B surface antigen will become undetectable and will be followed by IgG antibodies to the hepatitis B surface antigen and for core antigen. A person negative for hepatitis B surface antigen but positive for anti-hepatitis B surface antibodies either has cleared an infection or has been vaccinated previously. Individuals who remain hepatitis B surface antigen positive for at least 6 months are considered to be hepatitis B carriers as discussed before. Carriers of the virus may have chronic hepatitis B, which is manifested by elevated serum alanine aminotransferase levels. PCR tests measure the amount of hepatitis B virus DNA called as viral load. PCR is used to assess the patient's infection status and to monitor the treatment. Acute hepatitis B infection usually do not require antiviral treatment and it is managed conservatively and most individuals clear the infection spontaneously. Early antiviral treatment may be required in less than 1% of cases who develop fulminant hepatitis or are immunocompromised. On the other hand, treatment of chronic hepatitis B may be necessary to reduce the risk of cirrhosis and liver cancer. Chronically infected individuals with persistently elevated serum alanine aminotransferase, which is a marker of liver damage, and elevated hepatitis B virus DNA levels are candidate for therapy. Treatment lasts for 6 months to a year or even longer period of time depending on medication and genotype. There is no drug which can completely eradicate hepatitis B virus infection. However, goal of treatment is HBe seroconversion, reduction in hepatitis B virus DNA, normalization of LFTs. Although none of the available medications can clear the infection, however, available medications can stop the virus from replicating, thus minimizing the liver damage. The medications which we can use in hepatitis B are lamivudine, adifovir, tenofovir disoproxil, tenofovir alfenamide, entecavir, and interferon. WHO recommends tenofovir or entecavir as first-line agents. Hepatitis B virus infection can cause serum sickness-like syndrome, polyarteritis nodosa, membranous glomerulonephritis. Hepatitis B virus DNA remain in the body after infection, and in some people, including those that do not have detectable hepatitis B surface antigen, the disease reoccurs. Hepatitis B E antigen negative chronic hepatitis B represents potentially severe and progressive form of chronic hepatitis B. Vaccine is ineffective in those already infected by hepatitis B virus. Vaccination is particularly recommended for high risk groups. A protective response to vaccine is defined as an anti-hepatitis B surface antibody concentration of at least 10. Protection lasts for 20 years and longer period of time. In this slide we can see what should we do when we are exposed to hepatitis B. Hepatitis B infection can be prevented by receiving vaccine and hepatitis B immunoglobulin soon after the coming in contact with hepatitis B virus. This should be done within 24 hours but not more than 2 weeks after the exposure. Perinatal hepatitis. Without intervention, a mother who is positive for hepatitis B surface antigen has a 20% risk of passing the infection to her offspring at the time of birth. This risk is as high as 90% if mother is also positive for hepatitis B E antigen. Infants should receive hepatitis B immunoglobulin and hepatitis B virus vaccine to prevent from infection. If pregnant woman has high hepatitis B virus DNA levels, tenofovir can be given in the second or third trimester. Thanks for watching. Like and share our video.